Hi, my name is Amelia Speaks. I am a student in the RN to BSN program at Winston-Salem State University. Today I will be doing a health assessment video on the peripheral, vascular, and lymphatic system. My patient, Muna Hagi, has given permission to authorize me to use her in this video. For demonstration and student purposes, we are going to be doing all assessment over top of the clothing with just description of what I'm doing. This video is a brief overview of the health history, followed by anatomy of the peripheral vascular system, including the arteries, veins, and lymph nodes in the arms and legs. I would then perform an examination of the peripheral vascular system, including veins and arteries of the arms, hands, legs, ankles, and feet. I will also be inspecting and palpating the superficial inguinal nodes, and then finally I will assess for chronic arterial insufficiency. The initial health history interview has a threefold effect. You are trying to establish a trusting and supportive relationship, gather information, and also offer information. At that point, you would note any chief complaints and any comment or concerning issues with the system. Some of the common symptoms that would be could be pain in the arms or legs, intermittent claudication, cold, numbness, or pallor in the legs, hair loss in extremities, color changes in fingertips or toes in cold weather, swelling in the calves, legs, or feet, and swelling with redness or tenderness. Muna, have you had any of these symptoms lately? Anything of concern at all in your extremities, arms, hands, feet, legs, ankles?
No.
Okay, thank you. A brief anatomy review. The peripheral vascular system includes the various structures involved in circulation to the arms and the legs, including arteries, veins, capillary beds that connects the two, and the lymphatic system with its lymph nodes. Arteries carry oxygenated blood away from the heart. The pumping heart makes this a high-pressure system. Each heartbeat creates a pressure wave which makes the arteries expand and then recoil. All arteries have this pressure wave, or otherwise called pulse, but it can only be felt at body sites where the artery lies close to the skin surface. In the arm, arterial pulses can be felt in three locations. The brachial pulse, which is felt at and above the bend of the elbow, medial to the biceps tendon and muscle. This would be the brachial. Excuse me, wrong. Brachial. The radial pulse felt on the flexi surface of the wrist, lateral. Radial. The ulnar pulse is felt at the flexi surface of the wrist medially, however, it is not always palpable due to overlying tissues. The ulnar would be here. There is an arterial arch that interconnects the radial and the ulnar arteries that helps protect the hand and the finger circulation from arterial occlusion. This arterial arch runs here as I'm demonstrating. In the legs, the arterial pulses are usually felt in four places. The femoral artery in the groin, which is located here. The popliteal artery, which is behind the knees. The dorsal pedis artery on the bottom or dorsum of the foot. Sorry, there. And the posterior tibial artery, which travels down the medial malleus and in the foot forms the plantar arteries. That is located, let me use this foot, right here. There. Again, as with the hand, the foot also has an interconnecting arterial arch that protects the circulation of the foot. On the foot, it runs here. Sorry, we're doing what we can with the video. Veins, which may be deep or superficial, carry deoxygenated blood to the heart. Because veins are more susceptible to dysfunction, close attention needs to be paid to them during assessment. Unlike arteries, veins are a low pressure system. Because veins do not have a pump to generate their blood flow, the veins need a mechanism to keep the blood moving. This is accomplished by three ways. 1, contracting skeletal muscles that milk the blood flow back to the heart. 2, the pressure gradient caused by breathing in which the inspiration makes the thoracic pressure decrease and the abdominal pressure increase. And 3, the intraluminal valves ensure that unidirectional blood flow is toward the heart and prevents backflow. Deep veins run alongside the deep arteries and conduct most of the venous return from the legs. These are the femoral and the popliteal. As long as these veins remain intact, the superficial veins can be excised without harming the circulation. The superficial veins are the great and the small saphenous veins.